Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 cardiac NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A client suffers from pain in the legs and hips when he walks or stands for long periods of time. The nurse notes that the skin on his legs appears pale and it feels cool to the touch. Which of the following nursing interventions would the nurse most likely perform to improve circulation for this client? So because he is not getting adequate blood flow, we want to apply compression stockings. The client in this situation may be suffering from decreased perfusion as manifested by pain with walking in cool, pale skin. The nurse should strive to increase blood flow, particularly to the lower extremities, and this involves applying compression stockings to help with venous blood return. You can pause to read the other rationales. The client's issue is not related to a lack of hydration, but rather their ability to circulate the blood properly. The veins have little valves, and if those valves aren't working properly, they aren't able to bring the blood back to the heart. A client is brought into the healthcare clinic after suffering a laceration that caused severe bleeding. The nurse should assess for which signs or symptoms that would indicate anemia. Select all that apply. Weakness and dizziness, yes. Fatigues easily. Bradycardia, no, they'd have tachycardia. Flushed skin. Actually, they would be pale. So they would be pale. So these 3. So, the way that anemia presents, just think about somebody that like short distances, they're like huffing and puffing. They're pale because they don't have enough red blood cells. Anemia can develop with hemorrhage if the client loses enough blood to impact hemoglobin levels. Signs and symptoms of anemia include cool extremities, weakness, and dizziness, easily fatigued. The nice thing about nursing.com is if you need a refresher, they have videos on the topic that you missed. The student nurse is observing the waveforms on an EKG and notices an abnormal P wave on the EKG. The nurse knows that this is a problem with which of the following? So the P wave is the depolarization of the atria of the heart. And this is a knowledge-based question, so it would be good that you take advantage of knowledge-based questions because you may not get a lot of those on the NCLEX. A nurse is working on the rapid response team of the hospital and is called for a situation in which a patient with acute coronary syndrome is experiencing chest pain and shortness of breath. The nurse has standing orders for administration of drugs in this situation. Which of the following medications would most likely be administered first after the nurse arrives? When someone is having a heart attack, think of Mona B, morphine, oxygen, nitroglycerin, aspirin. And sometimes they're giving beta blockers. But first, I would say aspirin because aspirin has antiplatelet properties, so we don't want those platelets sticking together. When a patient is experiencing chest pain but has not collapsed, the nurse should administer a dose of aspirin as an initial drug. Aspirin is an antiplatelet medication which slows platelet aggregation and improves blood flow. The recommended dose for a patient with acute coronary syndrome is 160 to 325 milligrams of baby aspirin. A student nurse is measuring an EKG strip. Which of the following elements on this rhythm strip demonstrates that this client is in normal sinus rhythm? Select all that apply. The R to R interval is consistent from one R to the next. The heart rate is 90 beats per minute based on the EKG strip. Interval is 0.18. There are 2 P waves for every QRS complex now. The normal duration for a QRS complex is between 0.08 and 0.1, so this is correct. And a normal PR interval is between 0.12 to 0.20, so this is correct. This is a second degree block when you have 2 P waves for every QRS complex. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.